One of the biggest fears that many patients have when they're undergoing a hip replacement is to have a leg length discrepancy after surgery where one leg is longer or shorter than the other leg. In today's video, I'm going to answer all the questions that you might have about leg length discrepancy. Hello, I'm Adam Rosen and welcome back. So today I'm going to talk to you about leg length discrepancy after total hip replacement. And again, this is one of the most common concerns or fears that many of my patients have. So the first thing that I like my patients to understand is that when you have hip arthritis, your hip or your leg is essentially short, even though you may not notice it, because it's happened slowly over months and years. The cartilage on the ball is about 3 millimeters thick, and the cartilage on the cup is about 3 millimeters thick. So essentially your hip is 6 millimeters short, and in a matter of an hour, we add that back to put your hip socket back into its normal position in the center, and you're going to feel long because it was 6 millimeters short this morning and now it's 6 millimeters longer. Some people are more sensitive to those few millimeters than others, but studies have shown that most people in 8 or 10 weeks will feel equal, meaning that they'll get used to the normal new position that their hip socket is in. The other thing with hip arthritis patients is many of them have what's called a hip flexion contracture. So in the knee, it's a lot more noticeable. You see somebody walking around with a bent knee that doesn't straighten. And the same can happen in a hip due to arthritis. So if you're walking with this flexed hip, and then in the surgery, we remove the arthritis and remove the bone spurs, and now the hip straightens, you're going to feel longer at first because this hip can now straighten, and for months or years, it has been in this bent position. The other group of people that sometimes will feel longer is people that have arthritis in both hips. If we're doing one hip today, again, we're putting that hip 6 millimeters longer back to its normal center of rotation, while your other hip, the arthritic hip, is still shorter. So you might look at it as the arthritic hip is still short, or your new hip feels long, and when the second hip is done, both legs are going to feel equal at that point. And we're doing this with a lot of information. So during your pre-op assessment, your doctor may use blocks and put them underneath your foot to see how you feel, because what you feel doesn't always equal what we measure, because we're measuring your x-rays before surgery, we're measuring your x-rays during surgery, we're using special calipers during surgery, and all of that is meant to get as close as possible to what the normal length or position should be, but that comes second to one other risk that we worry about, and that's dislocation. So I always let my patients know that there's really two complications that go hand in hand: dislocation and leg length discrepancy. So during surgery, we want a hip that does not dislocate, a hip that's stable. You do not want a hip where the ball pops out of the socket. So during surgery, if we perform the operation and everything's perfectly equal, but your hip is unstable as we put it through the test of range of motion, there may be a reason or a need to make the hip longer on purpose to make the hip stable so it does not dislocate. So number one is stability. Number two, a very close second, is making the legs of equal length. There's another group of people. So you might be in this category if you have back arthritis, a scoliosis, or what's called a pelvic tilt. So many people that have bad backs, the pelvis tilts, and the ball socket on one side is higher than the other. So even though the lengths of your bone might measure equal, you might feel long or short on one side because the pelvis is tilted, and it's impossible to fix that during a hip replacement operation. So looking at x-rays and talking to your surgeon and using lifts in the office before surgery are going to help give you an understanding of what after surgery might be or feel like. Because at the end of the day, if you have a hip replacement and the leg feels longer, just rest assured, most people feel longer, and then in 6 or 8 or 10 weeks, that will go away as you become more used to and accustomed to that length. The pain has subsided, your balance may be better, the pelvis may untilt. You might feel long again if the other hip is arthritic. And if you're one of those people, when the second hip is replaced, you should feel equal at that point. But the third group of people, if you're that group that has a bad back and a pelvic tilt, you might feel long, it might be long, but in any event, if it's bothersome enough, especially if it's affecting your back, that's where using a shoe lift may be helpful in the shorter leg to help balance your balanced center of gravity, pelvis, and your legs so they feel of normal length for you. So I hope this at least covers a lot of the information about hip replacement surgery and your concerns about leg length or leg length discrepancy. If you enjoy this information, please subscribe so you're updated on future videos when they come out. And please click the like button so people like you that are looking for information like this can find it. Until next time, stay safe.